Hi there, we are Hannah, Casey, Ashley, Allison, and Sydney. We are Masters of Occupational Therapy students at Saginaw Valley State University. While this is a non-traditional setting and population for OTs to work with, we are very excited to dive in and get our hands dirty with this population and really help out because there's a lot that can be done. Not a lot of people know what OT is. So before we get going, occupational therapy helps people across the lifespan do things that they want to do through therapeutic use of daily activities, which we call occupations. Through these occupations and their therapeutic use, we help individuals live their life to its fullest, promote health, and prevent or help them better live with a condition that they have.
So the population of foster youth, any child in the foster care system is at risk for limitations in typical daily living opportunities of childhood, which may impact lifelong health and occupational well-being. This is kind of why we think occupational therapy is such a vital role to work with these children, because we could help with those problems early on. Foster youth have high rates of physical, psychological, and social problems compared to their peers. Some common conditions that they may experience include depression, substance use, oppositional defiance, anxiety, adjustment, post-traumatic stress disorder, learning disorders, and attention deficit disorder. Almost 25% of foster youth experience PTSD, which is double the rate of those active in military deployments and 6 times of the general public.
So now we're going to kind of look at occupational performance that have been seen in the foster youth population. And occupational performance is, as Ashley talked about occupations earlier, just how they tend to perform in those. So these are some areas that they tend to have difficulties in. Looking at activities of daily living, a lot of foster youth have difficulty in the area of hygiene awareness. With instrumental activities of daily living, there are difficulties in household management, the concept of money, both earning and saving, healthcare management and maintenance, safety and emergency management, and then shopping. And looking at this quote over on the side, this really hits home with how they have difficulty with healthcare management and maintenance, because not only is it a difficulty with what they're actually doing, but it's just being able to access things and knowing what's out there as well. When looking at education, a lot of them have increased risk of absenteeism. There's increased rate of grade retention and high school dropout. In play and leisure activities, there's a decreased opportunity to engage in extracurricular activities. And there's also little exposure and a hesitancy to engage in activities because of triggers that they may have. There are a lot of challenges with sleep and rest, in falling asleep and staying asleep because of anxiety and stress. And then when looking at social participation, a lot of the foster youth have difficulty expressing emotions in an appropriate and healthy manner. And then they also have difficulty with building and maintaining those healthy relationships and boundaries.
So moving into what the OT role is with this population, specifically what we can do with them. So individual services for adolescents aging out of the system, or those who have been emancipated, will consist of evaluations. So we'll conduct an occupational profile, which is basically just an interview where we can get a good idea of what's important to this individual, what their environment's like, what their supports are, and what their barriers are. And then we will also, through occupation-based interventions, we'll use those daily activities that are meaningful to them to help improve the areas of self-care, home management, job seeking, education, leisure, sleep, rest, social participation, any of those occupations that may need a little extra help. So OT specifically, we can assist the youth transitioning out of the system to help develop their future goals and skills. So what we're doing right now with River Jordan, the OT students there, they're creating modules which provide the individuals with training and information on areas of job seeking, job obtaining, job maintaining, things like home seeking, home attaining, and home maintaining, as well as promoting everyday participation in meaningful occupations, engagement in occupations in general, leisure exploration, and establishment of routines.
Another major area OTs can focus on is mental health. Occupational therapists can support individuals who may have conditions such as depression, anxiety, PTSD, and those at risk for substance use by educating clients on healthy coping mechanisms and facilitating peer support. Occupational therapists can instill resiliency in their clients, which can later lead to an increase in adaptive coping strategies, confidence, and healthy stress management, which can later lead to an increase in meaningful engagement in occupation. OTs can also provide group intervention. Occupational therapists are well versed and trained on group processes and group dynamics. Groups can be comprised of individuals who have similar diagnoses and backgrounds. OTs can help groups achieve a common goal while engaging with peers. The purpose of the groups are to build trust, allow for self-expression, increase motivation, and provide an opportunity for peer support with individuals who may have experienced a similar situation. The topics of group discussion can surround similar problems and situations the clients have gone through. Some examples of group interventions can be painting, woodworking, and anything involving sports.
So for some evidence for OT in this setting, occupational therapy is an evidence-based profession. So there's a lot about foster youth in the literature out there, but OT has a substantial role in the foster youth population. OT can help promote independence in activities of daily living and instrumental activities of daily living with a motivational approach. Interventions are targeted at a universal, targeted and intensive level. These are the tiers of mental health. The universal level is occupational therapy can help with finding other resources for kids at this level. The targeted tier, occupational therapy can help implement trauma-informed principles and training into welfare programs as well as schools for at-risk children. Occupational therapy can also partner with programs to develop the best plan of care for children. The intensive tier, occupational therapy treatment within the clinic or at the foster home occurs at this level of mental health treatment. Advocating for the children's needs become more prominent. Practitioners can help with relationships among teachers and focus on developing skills for everyday life, such as cooking and cleaning. And then a quote from the article, occupational therapy practitioners can intervene at the individual level by assisting transitioning youth to develop future goals and the skills needed to achieve them. At the community level, practitioners can be instrumental in the planning, delivery, and evaluation of occupation-based transitional programs in which youth become successful by doing.
So then some possible assessment tools that could be implemented by occupational therapists in the foster youth settings would be the school function assessment, the children's assessment of participation and enjoyment preferences for activities of children, the preschool behavior checklist, the adolescent role assessment, the resiliency scales for adolescents, a profile of professional strengths, and the multidimensional self-concept scale. Occupational therapy can assess clients holistically and investigate their individual needs. And these assessments can evaluate a client's school performance, function, participation in leisure activities, behavior and emotional regulation, current and past roles, and also help assess a client's abilities to manage adverse experiences. These are only some of the assessments that occupational therapists could use in this setting that could help the foster youth engage in a more meaningful life. And then as we were doing research on occupational therapy's role with this population, we found some websites that had some pretty good fact sheets when it came to OT's role in mental health promotion, prevention, and intervention with children. And then also OTs working with children who have experienced trauma. So we included those links there for either your viewing or to inform other individuals about our role in this population.